The management of Trust Bank on Wednesday, January 18, 2023, presented items worth a little over $300,000 to the dialysis unit of the Edward Francis Small Teaching Hospital. This is part of their annual corporate social responsibility contribution to healthcare facilities across the country. Speaking at the presentation, the Deputy Managing Director of Trust Bank, Omar Mboub, says the donations encapsulates the fantastic role that the unit plays in the lives of patients living with kidney problems.
This donation today encapsulates the fantastic role that the unit plays in the life of patients living with kidney problems. It does not only include medical supplies and other consumables, but most importantly, the love and generosity of the Trust Bank family to the patients and staff in this unit. Distinguished ladies and gentlemen, please allow me to remind ourselves that the presentation today is just a continuation of the work that Trust Bank has been doing in collaboration with the Ministry of Health and Social Welfare to support the government in the provision of good and quality health care. Ladies and gentlemen, in 2019, Trust Bank lost a staff, Mr. Ibrahim Fraser of blessed memory, to the cold hands of death. Mr. Fraser used to come to this facility for dialysis treatment. We all know how difficult such a condition can be for the patient and the people around them. It is against this backdrop that Trust Bank decided to lead the way to ensure that people living with such medical conditions have access to dialysis treatment.
He adds that getting regular dialysis treatments, usually 3 times a week for 4 hours at a time, will only help the patients to keep alive, but the transplant will offer them more freedom and the ability to live longer, healthier, and a more normal life.
We must strive to reach a point where organ donation will become the norm when opportunities arise. To achieve this, we need to drive a fundamental culture shift in our society, a culture which has left patients with little or no hope to life. In pursuit of that goal, we could start by ensuring that all those who died in circumstances where organ donation was a possibility are recognized and that their families are made aware of the possibilities of giving the gift of life to others. We need to encourage the public to share their views on organ donations, especially at a family level.
Mariama Balajo, the nurse in charge of the unit, assures the bank that the items will be put into good use.
On behalf of the dialysis unit, the nurses, the doctors, and our patients, we are saying thank you. This is not the first time you guys are giving such donations to dialysis. And on that note, we are looking forward for more and promise that the items that are given will be put into best use as they came in time, because we are highly in need of it. It will take us a long way. So on behalf of the patients, I'm saying thank you to Trust Bank. And I'm saying again a big thank you for maintaining the trust and confidence we have in you. Once again, thank you, Trust Bank.
Dr. Abubakar Jain, Deputy Chief Medical Director, thanked Trust Bank for the kind gesture they rendered to the hospital.
Because often people have to go around searching for this. Each of them costs in Gambia almost $4,000, $5,000. Sometimes they go up to $6,000 when they know it's in short supply. And the patients, the families have to struggle to get this. Although dialysis is free, almost free for all Gambians, but then to get this, they have to go, sometimes they don't even know where to get it. They travel around looking for it. When they get it, then the cost is difficult for some people to, because of that. So some of them who are on dialysis already, if that catheter gets spoiled and they need to replace it, becomes a big challenge.
Trust Bank has been donating items to major healthcare facilities across the country as part of their corporate social responsibility program. Reporting for Kerr, Fatou, I am Fatou.